Welcome back. It's 12:17 now. No matter what stage of life you're in, an annual physical is essential, as doctors tell you, to your overall health and wellness. Seeing your primary care provider for this exam is just one of the best ways to identify and treat health problems early. And today we have joining with us again Dr. Timothy Quinn to break it all down. Dr. Quinn, I'm excited we're doing this segment because I need to get my annual wellness exam too. But talk to us about the benefits of getting one.
The cholesterol checked, all these other things that are so important. It also gives you an opportunity to get acquainted with your primary care provider, where you and your primary care provider can discuss what's going on in your life, because we set aside a great deal of time so that we can do this. And a good example was a patient last year that was going through a divorce. And he shared that he was having problems on his job and he couldn't sleep. But because we had that opportunity and that time set aside, we were able to help him. We got him some therapy. We gave him some medication to help him sleep better at night. And he got through that time successfully. And it was all because of the fact that he got his wellness physical exam and that just that visit with that doctor one-on-one.
That's awesome. Now, the American Heart Association provides encouragement for everyone to know their numbers. So what are they referring to here, and how can an annual wellness exam also help with this, Dr. Quinn?
Great question. Great question. Know your numbers. And this is also a big part of the wellness exam. With the wellness exam, we check the blood pressure. It is so important because we talked about earlier cardiovascular disease being the #1 killer in the United States, and knowing that blood pressure, that empowers the doctor and the patient. So if the blood pressure is a little bit elevated, we can either start medication if needed, determine from the history, or if the medicine is not strong enough, we can increase the dose, but we can get that blood pressure down. We want to check the BMI. If someone's a little bit overweight, we can give some diet and exercise advice and look at other options. Check the cholesterol. We want to get that down if it's elevated. We determine all that during the wellness exam. But also looking at that glucose, because so many people have pre-diabetes and diabetes, and a lot of these individuals don't even know, because most medical conditions, if diagnosed early and treatment started, the impact is significant, but a lot of people during the early phases don't know, so it's not treated. But getting that wellness exam provides the opportunity for it to be identified and treated.
Yes, absolutely. Early detection. Now, what other information, or encouraging information, do you want our viewing audience here at WJTV 12 News to just know about annual wellness exams?
Well, one thing I really want to put out there to my men out there, my men, and also my ladies, so they can tell their husbands and their fathers, if you go get your wellness exam and you don't want to get that man test, and you know what I'm talking about, where we check the prostate, you can let the doctor know. Let's do the blood test, the PSA, prostate specific antigen. And with this test, we can screen for prostate cancer, and we don't have to do that man test. And giving the patients the option, it increases compliance with men getting their wellnesses. So all the men, let your doctor know you like to have the blood option if you just don't want to do that man test, and know that it is an option. But get your wellness exam. It is so important, and it can actually save your life.
Absolutely. Thanks so much, as always, Dr. Quinn. Thanks so much for those great tips.